Good morning all. I am here to talk about the improvement in outcomes of school eye screening program through repeated reminder phone calls. As we know, India is home of growing and largest childhood population in the world, which contribute around 40% of total population. So what is the need of this study? This can only be understood if we know what are the impacts of decreased vision in a child. 80% of what a child learns is through vision. So childhood ocular morbidity can hinder child motor development, language skills, cognitive skills, his education, personality and financial outcomes. So we can say that the childhood blindness can ultimately affect a family and a society. So it is very essential to plan strategies to fight at the root level difficulties like cultural barriers and practices and socio-economic barriers. One such initiative is School Eye Screening Program, which is the second largest program under NPCB after cataract surgery. This program includes vision assessment and gross eye examination like pupillary reflex measurement, ocular motility and red reflex. So what after the screening? All the children with eye problems were referred to higher center for further evaluation and management. This is where we are lagging behind. Various barriers have been identified which create hindrance in this referral path, and delay in treatment of some of these eye problems can cause irreversible vision loss through amblyopia and other complications. So what was our focus? Our approach relies on the telecommunication, in which a trained telecaller prompts the parents of the identified children to reach to the base hospital. And the objective of our study is to evaluate the effect of these repeated reminder phone calls. In this prospective cohort study, a trained telecaller discussed the severity, management and prognosis of eye disease with the parents and motivated them to reach to the hospital. In this module, reminder call is given to the non-reporting parents on day 15 and then on day 30 and 45 after the eye screening. Now coming to the results, 3.5% of all the screened children were referred for further management. Here the crucial point is that only 10% of all the referred children reported to the hospital by themselves. Here we can clearly see that the self-reporting percentage was very low, which improved significantly through the reminder phone calls. In our study, major cause of referral was the refractive error followed by various other ocular pathologies. And here in flowchart we can see that of all the referred cases, the reporting has been increased through reminder phone call. Still there is a huge lacuna of non-reporting. So what are the factors responsible for this non-reporting? A proper questionnaire was prepared and a set of questions were asked to the parents telephonically, and we came on conclusion the lack of awareness was the major limiting factor, followed by the financial constraint and the transport issues. So these screening programs are very helpful to detect the unidentified vision problem in children and guide the parents for further evaluation. Lack of awareness was the major limiting factor in these screening programs, but our approach of reminder phone calls is very effective to overcome these problems. So in conclusion, our study emphasized the need for preschool screening and improving the referral follow-up by creating awareness through reminder phone calls. Thank you.
Good. Now in few schools, I think it is mandatory that every year they ask their students to get the medical checkup done, basically in the private schools.
Yes.
But when it is the government school, the school for poor children, basically parents, they are not taking that much care. And then when it is free, they feel that something experiment may be done on our children. And then they don't take seriously, and because of few other issues also, when they are busy in their farms and on their work, they don't take their children to hospital and screening. In that case, even phone calls they don't attend, and then they don't follow. You can't follow those parents. In that case, what you do?
So in our study, we included only the parents who take up our call and discuss the disease management and prognosis with us.
So
We
you
did not
should
follow up the parents who did not take up our phone
yeah.
calls.
So it is possible that the parents, you yourself call or teacher call. You yourself.
Telecaller.
Yeah. So it is possible that you can remind again to teacher You take your device to the school itself and you can do comparative study, non-reminding how they presented, what they lost by not coming, and who are benefited. So that can be a addition,
We'll do it in
extension
future,
of the study.
Which
yeah.
age group?
School,
Which age group? School means from.
First to
First
10th.
mainly
year
from
to-
5 to 15 years.
You have not mentioned anything over there.
Yes.
No, you have talked about childhood blindness. Means
have not talked
children
about this.
below 5 years are not screened.
They are in school also. They are going to school.
They may be having some problem like retinoblastoma, squint, something of that sort.
Definitely,
In
sir.
age group less than 5.
So we mainly
You have
screen
not
the.
mentioned anything about the age.
Yes, I
You have
know.
just
That is very
mentioned
important.
School nowadays, from what age school starts? When people are selling to nursery,
Yes.
school. Age limit has to be there doing which you are doing the study. Okay. So
Okay.
that is also changes with your
Yes.